ankle arthritis in young adults and the treatment option with distractionosteogenesis. In this talk, I will go through ankle arthritis in the young age group, the literature on ankle distraction, the technique that I use in Edinburgh, and the results. The literature shows that ankle arthritis is as disabling as hip arthritis. It also shows that 70% of patients are post-traumatic and that the mean age of ankle arthritis patients is 12 to 15 years younger than hip and knee patients. In this age group, the problem is more challenging due to the demand and expectations, and both fusion and replacement are far from ideal treatment. The literature on ankle distraction shows some good results, but invariably are small studies with short-term follow-up, like a study here from Van Velberg showing 75% improvement in range of movement and 50% improvement in joint space. Another study showed significant improvement compared to arthroscopic ankle debridement. A comparison between static and dynamic distraction showed improvement in the dynamic group with better AOS score. Other studies showed improvement of subchondral sclerosis, reduction in size of subchondral cysts, improvement in pain visual analog score, anterior debridement and Achilles tendon lengthening improved survivorship, which was about 70 to 80% at 5 years. There is no agreement on the technique, and most studies report static distraction with an Irizarov frame or a TSF frame. So let me tell you about my 3-stage ankle distraction technique that we currently use in Edinburgh. So this is a 23-year-old lady with post-traumatic ankle osteoarthritis following a bimalleolar ankle fracture 3 years earlier. She had ORF followed by removal of metal and ankle arthroscopy. She's very fit and healthy. She told me, I'm in a lot of pain, but I don't want an ankle fusion. You can see here that her dorsiflexion is limited. Now this is important because the tight calf muscles play an important role in turning the class 1 lever of the normal ankle into a class 2 lever that functions like a nutcracker. So I offered her ankle distraction. This is the frame. It is formed of a base frame and a foot ring and constrained hinges. The hinges must be placed at the center of rotation of the ankle joint. We must check this with image intensifier intraoperatively. Stage 1 involves distraction of the ankle by lengthening all the connections. Stage 2 involves lengthening of the posterior structures by lengthening at the back and shortening at the front. And finally, stage 3 involves removal of the anterior and posterior connections and allowing ankle movement while the ankle is still distracted. That is her in the frame weight bearing. These are her X-rays. And that is her ankle distracted about 8 millimeters. And that is her moving from stage 1 to stage 2. Frame is removed between 10 to 12 weeks with no further immobilization. Physiotherapy starts immediately. These are her X-rays before and 5 years following distraction with clear improvement in joint space. Same can be seen here in the lateral view with significant improvement in the joint space. Clinically, her dorsiflexion range improved significantly, but most importantly, this patient is now pain-free and back to all her daily activities, including running. She's now actually 12 years following the distraction, and she's absolutely fine. This is another very similar case, and you can see the joint space is continuing to improve. I can show you so many cases like this, but here is another one with progressive improvement of the joint space. The amazing finding is that the joint space is still improving between 6 and 12 years following the distraction. We had failure in 12%. All failures were early and needed definitive surgery within the first 2 years. Most failures had previous ligamentous injuries and were unstable or had malaligned. That is why we are not offering these patients ankle distraction now. 14% needed further joint preserving surgery, either arthroscopic or open anterior ankle debridement. We are preparing our minimum 8-year follow-up data for publication shortly, but we have a survivorship of 88% at 8 years, with significant improvement in all patient-reported outcome measures that was maintained after the 2 years post-operative mark. Our current criteria for ankle distraction is an age less than 45, severe ankle osteoarthritis, minimal coronal plane malalignment, limited ankle dorsiflexion less than 5 degrees, no instability. I managed to talk all my smoking patients into stopping prior to the distraction. We believe that these are the patients who get the best results. So in conclusion, ankle distraction with this 3-stage protocol can offer a promising alternative in a challenging age group where both fusion and replacement are far from ideal. Larger studies are needed to confirm these results.